Hello, my name is Dr. Annetta Rayson, and I am the director of the Psychiatry Residency Training Program. And I would like to welcome you to this webinar titled Building Resilience and Coping with the Stress of COVID-19. Joining me in moderating this webinar are two of our mental health experts, Dr. Erica Hutchison, our senior psychologist in the Department of Academic Affairs, and Dr. David Miller, our chief psychologist in the Department of Psychiatry, program director of the Psychology Internship Program, and director of the Wellness Recovery Program. While our hospital leadership is working hard to make sure that all operations run smoothly and staff are updated on clinical information, our team of mental health professionals wanted to capture another important aspect of this pandemic, the mental health impact that many of us are experiencing. It is important to remember that we are all in this together, but we might be affected by COVID-19 in unique ways. This pandemic resulted many of us to experience a range of different feelings, emotions, and manifestations of mental stress. To some, these emotions can be new, may be confusing, or feel unsettling. Although stress is a normal and sometimes expected human response to threatening circumstances, its range can be mild or more significant, leading to difficulty in functioning and continuation of the normal routine. Mental health support is never a one-size-fits-all. So it is important that we each consider how and to what extent we are affected to better care for ourselves. Identifying our needs can help us feel better, decrease the chances of long-term mental health stress, and increase our resilience and ability to cope with future stressors. Through this webinar, our hope is that we can increase awareness of the COVID-19 impact of mental well-being for all hospital employees, recognize signs and symptoms of mental stress related to COVID-19, learn strategies for building resilience and coping, and finally, to identify additional resources that you can use. To begin, I would like to walk you through a story, one that captures the essence of what so many hospital employees have experienced and shared over the past several months, and one that most of us can identify with to some degree. Please note that the clinical references are not about any one individual from this institution. To begin, I would like to share the story of an individual who we will identify as Mrs. B. Mrs. B lives at home with her husband and two school-aged children. Mrs. B has a history of asthma that has been well controlled and no other illnesses or previous psychiatric history. Mrs. B has been employed in the hospital and since the onset of the COVID-19 pandemic has experienced numerous feelings that were difficult to identify but began causing her distress. She initially described fear that was difficult to control on the way to work every day, mainly because she didn't know what to expect, including her responsibilities for the day, and even more so, fear of coming home every night to her family. The thoughts of getting her immediate family sick was devastating, and she began to self-quarantine in the basement. Not being able to care for her small children was emotionally taxing and placed additional burden on her husband, which resulted in a tense home life that was difficult to navigate, making Ms. B feel alone, isolated, and without her immediate support system that she can rely on to feel better. A few weeks into the pandemic, Mrs. B learned that a staff member with whom she was close with at work died because of complications of COVID-19. At this point, Mrs. B described feeling sad, dejected, helpless, not knowing what she can contribute or how this will end. And this took a physical toll on her, making her feel, as she described, having quote unquote no energy. She also developed problems with sleep, often laying awake most of the night with thoughts of the pandemic running through her mind. Despite this, Mrs. B continued coming to work every day, as she did have an important role to play, and her team was relying on her. She considered at one point taking a leave of absence or even quitting, but she enjoyed her career. She worked hard for it and relied on her work to financially sustain her family. Being vulnerable and already experiencing symptoms that she kept pushing aside, it became even more difficult to function at work and process the psychological toll that she was experiencing. She became more tense, frustrated, and at one point even angry with her supervisor for items that she thought could have been managed differently, and indifference and blame to those affected by the virus, saying that they should have been in quarantine at home, leading to her own compassion fatigue. With the ongoing uncertainty and little time to orient and adjust to changes, she endured further trauma when she had a particularly difficult shift where a few of the ongoing patients she was working with had passed away in the span of a day. Since then, she has been replaying the codes over and over, began experiencing nightmares, feeling jumpy, and couldn't stop picturing the scenes she was a part of during that day. It was then that she decided to reach out to the Wellness Task Force to find ways to address her symptoms and look for resources to help her regain power and meaning with her own position and manage through the mental, emotional, and physical distress she has been experiencing, realizing that she would not know where to begin on her own. As you heard from the story, the individual was affected in multiple ways. However, it is important to remember that we will all experience some degree or level of distress with variation based on our own personal backgrounds, exposures, and other aspects of life. In the next portion of this webinar, Dr. David Miller will walk you through the select mental stress signs and symptoms to help you identify some of the feelings you may be experiencing.
The following slides are meant to take us through the clinical manifestations of living through the coronavirus crisis. As Dr. Rayson mentioned earlier, we do not expect that any particular individual will experience all the signs and symptoms, nor do we believe that anyone necessarily meets criteria for a psychiatric condition. Instead, we hope these slides help us to become more mindful of our emotional health hygiene and perhaps make it possible for colleagues and managers to notice when anyone might need some extra assistance. We now go to our first slide. You will notice that the diagnostic and statistical manual signs and symptoms are embedded in each slide. However, we are going to focus specifically on the signs and symptoms specific to COVID-19. We'll start with anxiety. We may find that some of our colleagues have a fear of contracting the illness itself, or they may have a fear of infecting loved ones, or even colleagues. Concerns about not being able to care for one's children or elderly parents is also common, or concerns about just not being able to perform in the clinical setting. Not to be understated, of course, are financial concerns and anticipatory anxiety about the next day's work responsibilities. It is also not unusual to have vivid dreams or poor quality of sleep. We now go to depression or lowered feelings. Here, colleagues might be feeling isolated from family, friends, one another, or perhaps experiencing a helplessness in being able to care for one's patients. A general sadness regarding the losses due to the pandemic is not unusual. And then anger and irritability in response to perceived futility. Feeling emotionally drained at the end of a day or shift, very, very common. And persistent sadness or powerlessness, just not being able to contribute more. Lastly, we may have a feeling like we're a burden to family or friends. Next, we have post-secondary traumatic stress. Perhaps colleagues are experiencing nightmares about patients dying or struggling for breath. Or the fear that it's only a matter of time before we become a patient ourselves. Some may even experience feeling as if they're gasping for breath. An exaggerated startle response to the sound of medical equipment, especially ventilators, is not unusual, and a strong desire to avoid specific units or work. Feeling detached from one's work on the unit or a sense of reality, derealization, depersonalization, is also a possibility. And then there's finally the replaying of the codes that we heard in the overhead announcements over and over in one's head. And lastly, we come to compassion fatigue, that feeling as if you are low on empathy, feeling unable to do enough or as though your efforts are in vain. Some experience a deep exhaustion on a mental, emotional, and physical level, or may even experience acute irritability in response to a colleague or patient's requests. Under compassion fatigue, we also have burnout, something we are all familiar with, that feeling of exhaustion, detached, cynical, just simply less effective at one's job. And finally, there's moral distress or injury, knowing the right thing to do in order to provide the quality care, but being unable to carry this out, either due to institutional, governmental, or other constraints.
Okay, so now we're going to shift a little bit and think about some strategies for coping and building resilience. Specifically, I'll talk about 4 categories of coping, and you can keep in mind as I'm talking that these are strategies that we can use ahead of time to build up our coping and resilience resources, but they're also strategies that we can use in the moment when we're actively feeling stressed or overwhelmed. So the first category that I'll talk about is related to this idea of making meaning. And this idea is really strongly related to the concept of resilience. And resilience means really making it through and surviving a challenging event, but also gaining something along the way, growing or learning something as you make it through that difficult event. And so in order to try to build resilience and make meaning, there are 3 specific steps that we can follow. And another term for this is also adaptive coping, meaning coping with something that you have to adapt to, that you can't necessarily problem solve in and of itself. So the first step for adaptive coping or meaning making is to really accept the challenging situation for what it is, to really be honest and real with ourselves about what it is that we're facing and why it's challenging. Second is similarly to make some space for how we're feeling and to really name and feel those feelings. So whether we're feeling angry or sad or maybe like some grief or loss kind of experiences, if we don't know how we're feeling, it's really hard to come up with the right coping strategy to help ourselves feel better. So this is a really critical step. Third is to ask ourselves some questions to try to make some meaning of the experience. And so there are many different questions that you might ask yourself. And, all the questions that I have on this list here are potentially applicable, but they're not all going to work in every situation. And that's why there are so many to choose from. So you might think, can I learn something from this challenging experience? Maybe I can learn something about myself, about a strength that I didn't realize that I had, or I can learn about a particular skill or about something related to my profession. Or maybe there's a way to grow or challenge myself in this situation. It might be possible for me to positively impact others, perhaps my patients, colleagues, supervisees, or maybe, if those are not possible, maybe there's a way to connect with other people, to lean on my support system, to make new connections, to support others, perhaps. And then also to think about Maybe there's an opportunity for perspective taking. And so this one can be particularly helpful if we're having an interpersonal kind of difficulty with somebody, and thinking about why that person might be behaving or speaking in the way that they are can sometimes help us to connect with our empathy and to widen our perspective a little bit. And finally, and I think this is a really important one, we can ask ourselves, is this an opportunity for me to be kinder to myself, to practice giving myself a break or practice self-compassion in some way? And sometimes I think that this is, maybe the only thing that we're able to have some control over and do in the face of a really challenging situation. Okay. The second category that I'm going to speak about is this action-oriented thinking. And so this is really related to the idea that feeling helpless, feeling anxious, feeling stressed, all of these experiences are often worsened by the belief that we can't control our circumstances. And so in order to try to increase our resilience, increase our ability to cope, we might consider what we can control in the situation. In almost any situation, there's going to be something that we can have a say in or that we have some control over, even in the face of many things that we don't have control over. So noticing those things and then really trying to capitalize on them and make some active choices, again, even if they're relatively small ones. We can also try to widen our perspective. And something that happens when we're feeling stressed or overwhelmed or any other big emotion is that our perspective, rather than being really wide and being able to take in everything that's going on around us, it becomes more and more and more narrow until we're focused really in a very specific way only on the stressful thing that's going on. And it's kind of like having a little bit of a tunnel vision where that's the only thing that we can really take in and pay attention to. And so from an evolutionary perspective, this can actually be really helpful, right? So if there's an active threat to our well-being or safety, being able to laser focus on what that thing is and manage it is really helpful. It helps to keep us safe. However, we often get this tunnel vision when things are not necessarily an active, immediate threat to our lives. And in that situation, it's usually more helpful to be able to take in more of the full perspective, to notice not just the things that are stressful, but also the things that might be positive, the things that we might have some control over, that we might be able to make a difference in, things that might even be going well as some of the neutral things that kind of pad both of those experiences. So then if we look back at the week or at the day, rather than just noticing the thing that's stressful that kicks it over into the negative direction, we can also keep that in balance with some of the positive things that are going on and some of the neutral things as well. And that allows the stressful thing to take up less of our energy and less space because it's a little bit more in perspective. And then finally, practicing gratitude is always a good idea. There's a lot of great research that suggests that taking stock of and really appreciating the things that we have increases our resilience, increases our happiness overall. So figuring out how you might be able to practice gratitude, to be appreciative of the things in your life that are important to you, maybe on a daily basis, can be really, really meaningful. The third category of strategy is related to what I like to call getting grounded. And so this is really about trying to connect with things that are certain, that are unwavering, that are not likely to change, even in the face of so many other things that might be uncertain or unpredictable. And right now, there's certainly a lot of things that we don't know that are unpredictable. So in order to do this, we want to try to identify our individual anchor points. And one type of anchor point that's useful for many people is the idea of connecting with our personal and professional values. And so I'm going to throw up a list here of some potential values that might resonate with you. And so as I'm speaking, just try to take a look through and see if any of them kind of jump out at you and feel like an important part of who you are. And so our values are a really good anchor point because for the most part, they tend to be stable. They don't usually change over time or across situations once we figured out what they are, that is. So thinking about maybe being creative or empathic or reliable, or considering teamwork as a really key aspect of our professional identities. Knowing what these things are allows us to have something that's really solid and unwavering to lean back on in the face of many other things going on around us that we might not have control over. We do have control over whether we're connected with our values and whether we're acting in accordance with them. And, we're never going to be 100% connected to our values all of the time, and that's okay. But knowing what they are and being able to put words to them does help us to connect with them a little bit more often. And this is really nice whether we're stressed or not, because it helps us to, live and work in a way that feels really fulfilling to us. They can also be helpful in a quick kind of reset way. So if we're having a really stressful moment, trying to actively reconnect and be, for example, as curious as we can be, or as empathic as we can be in the next few moments, can be a really nice sort of contrast to an otherwise stressful moment. So some other ways that we might be able to get grounded, some other anchor points would include perhaps the way that we approach and speak with our patients or with our colleagues. This is something that we almost always have control over, how we talk to other people, how we approach them, what our attitude is, whether we're sort of, going out of our way to do something helpful for a colleague, or, whatever it might be for you. This is something that we do have some control over. For most people, there's like at least one or maybe a few relationships that feel pretty stable, at least for, the foreseeable future. And so knowing what these relationships are and maybe leaning back on them a little bit more during times of stress or feeling overwhelmed gives us something else to kind of hold on to as a home base or as an anchor point for us. And then finally, considering our other personality or identity characteristics that might be stable and unchanging, again, across situations or across time. Maybe, our sense of humor, or our sense of style, or some things about our religious identity or cultural or ethnic identity. All of these things are likely to be pretty consistent if they're core parts of who we are. And so they are things that we can kind of lean back on and remind ourselves are true, even in the face of really challenging situations. And finally, the fourth category of strategies is related to caring for our basic needs and creating a really solid foundation for ourselves. And so this is really very related to creating a routine and practicing some of these strategies daily. And so obviously, we know that prioritizing sleep, diet, and exercise is really important. It creates that more solid foundation so that we have a higher threshold for emotional stress as we go forward. And of course, our priorities are going to be a little different depending on who we are. The amount of sleep, the kind of food that we need to eat, and the way that we exercise and move our body is going to be different for all of us. So knowing what our ideals are is pretty helpful, especially if we can do that ahead of a stressful moment. We'd like to also consider our other self-care priorities. And so I really like this graphic, which points out 8 different areas of well-being or overall health that all of us are navigating all the time. And these 8 different areas, they kind of interact with each other, they're fluid, and they're really multifaceted. So there are many different things that contribute to our wellness in each of these different spheres. And so knowing for ourselves which are most important, which are our top priorities at any given moment, helps us to really know what needs some attention, what's going to help us to feel better at that time. And again, all of us have very different ideals in each of these areas. And so knowing what those are ahead of time can be really helpful in allowing us to figure out what we might need during a stressful moment. Practicing self-compassion is another sort of basic need that we all have. And so thinking about how we can be kind to ourselves and take care of ourselves on a regular basis can be really important. And then finally, connecting with our support. So not just knowing who they are in terms of an anchor point perspective, but also making an active effort to connect with them and utilize those supports when we need them is really, really critical. So now we'll shift a little bit and think about how do you choose the right resources depending on how you might be feeling and the type of mental stress that you might be experiencing. And so all of us all the time have access to a range of resources in terms of taking care of our mental health and our overall health. And they range from more informal to more professional. And so we can think about our individual self-care resources. So a lot of the things that we just spoke about, knowing what our priorities are and making some space to take care of those. And sometimes, if we're feeling stressed or a little bit anxious or a little bit depressed, this might be all we need to get back to our comfortable baseline. We also, of course, have our personal and collegial support systems. So again, considering the supports that we already have available to us and making sure that we're utilizing them in a way that that benefits our overall well-being. We also have group support available to us, again, formal and informal. So you always have the opportunity to join one of the groups that we're running here at Maimonides. But we also, at the same time, have access to our more informal support groups. So maybe our very close group of colleagues, maybe there's an opportunity to have lunch together or to debrief after a particularly interesting or difficult case, or to check in with each other at the end of a long day. So again, considering what our group supports are and when we might need them is really useful. And then, of course, there are the more professional supports. So all of us at Maimonides have access to the employee mental health clinic, where you can schedule an expedited appointment, usually within a day or 2 days, just by calling this number here and letting them know that you're an employee. And I'm also the psychologist on staff as part of the Academic Affairs Support Services. And so I also offer free and confidential counseling to all of the residents and fellows here at Maimonides. And my contact information is there below as well. And then finally, there are a number of really helpful professional support hotlines that are operated by professionals and are always confidential. So the NYC Well number is really useful for a couple of reasons. One, a person can call if they're feeling actively in crisis and they need a little bit of support, but a person can also call if they're looking to be connected with an outpatient mental health provider who takes their insurance and is maybe within a nearby area to where they live. There's also the National Suicide Prevention Hotline and the National Domestic Violence Hotline, which are just really good resources to have in your back pocket should you ever need them, or should a friend or a colleague ever need them. And so with that, we're going to conclude our webinar for today, and we'd really like to say a collective thank you for sitting with us and listening and learning a little bit. And it's really our sincere hope that a couple of the things that you heard today maybe resonated with you, and you'll be able to take those going forward and keep them in consideration when you're deciding how to best take care of yourself. So again, thank you so much, and please stay in touch.